Imagine a bright, friendly child who wants to join the group, but always ends up standing on the outside looking in. This child has an impressive vocabulary and a grasp of grammar that is essentially perfect. They can articulate complex thoughts with ease. Yet in actual conversation, they struggle. They frequently interrupt, blurt out off-topic stories, or take a joke literally. They also fail to adjust their language based on who they are talking to, speaking to the school principal with the exact same casual tone they use with a peer on the playground. This sharp contrast, high verbal skill paired with low contextual awareness, creates a disconnect that often leaves parents and teachers searching for a cause that isn't immediately obvious. Because the child can speak so clearly, observers often assume these inappropriate comments are signs of deliberate rudeness or a lack of maturity. This leads to a cycle of discipline. The child is scolded or punished for acting out, rather than being evaluated for a specific communication deficit. Over time, the cost of this misinterpretation is profound loneliness. Peers eventually drift away from a classmate who feels erratic, leaving the child isolated. From the child's perspective, this is agonizing. They genuinely want to be included, but they cannot identify the specific social friction they are creating. Treating a communication gap as a behavioral choice guarantees the isolation will continue, as the actual root cause remains unaddressed. This diagram shows two distinct parts of how we talk. While language mechanics covers vocabulary and grammar, the actual culprit for this behavior is social pragmatic communication disorder, or SPCD. Social pragmatics refers to the rules that govern how we use language socially, the system that helps us change our speech to fit the person and the setting. A child with SPCD is blind to the natural rhythm of a conversation. They struggle to master the timing of turn-taking and the necessity of staying on a shared topic. This also affects how they process subtle cues. They often fail to register hints, idioms, or sarcasm, hearing only the literal meaning of the words. SPCD is a localized blindness to context. The child has the vocabulary, but their brain isn't processing the social data needed to use words correctly. When a child struggles with social interaction, the most common clinical assumption is autism spectrum disorder. This Venn diagram shows the overlap. Both conditions feature significant social communication deficits, which is why they are so frequently confused. But the diagnostic difference is clear. SPCD occurs entirely without the restricted or repetitive behaviors that are required for an autism diagnosis. Because those physical markers are missing, SPCD is often invisible to untrained eyes. This lack of obvious symptoms is what leads back to the false bad kid label. To reach an accurate diagnosis, we must look as closely at the missing symptoms as we do at the ones that are present. The child is not trying to be difficult. They are simply unable to read the social expectations of the room. Once a licensed professional identifies the condition, SPCD is highly treatable through specific targeted interventions. Treatment involves speech-language therapy and intensive social skills coaching, which teach the child how to navigate conversational rules explicitly. Emotional support is just as important. It helps repair the psychological impact of being misunderstood and rejected by peers for years. By replacing punishment with coaching, these children can learn the rules they were missing and successfully reintegrate with their peers. MentalSpace School is a dedicated provider currently bridging this mental health gap in Georgia's K-12 schools. They eliminate the barriers to care by providing dedicated therapist teams for schools and offering students immediate same-day teletherapy sessions. This map represents their support network across Georgia, which is accessible to most families through wide insurance acceptance and $0 costs for those on Medicaid. No child should have to struggle alone with an undiagnosed disorder. If the signs look familiar, the resources to help are available right now. You can move past the cycle of punishment and start the process of healing. Reach out tonight at mentalspaceschool.com.